This medication is used to control and prevent symptoms such as wheezing and shortness of breath caused by asthma or ongoing lung diseases like chronic obstructive pulmonary disease, COPD. It contains two medications, budesonide and formoterol. Budesonide helps reduce irritation and swelling of the airways, while formoterol relaxes the muscles around the airways so that they open up and you can breathe more easily. By controlling symptoms of breathing problems, it can decrease time lost from work or school. It's important to learn how to use this medication properly before using it. If an asthma attack occurs, use your quick relief inhaler as prescribed. The combination of inhaled corticosteroid and long-acting beta agonists, such as this product, do not increase the risk of serious asthma-related breathing problems. Before using this medication, be sure to read the instructions provided by your pharmacist. Make sure to follow the directions for priming the inhaler if you are using it for the first time or if you haven't used it for more than 7 days. Also, remember to shake the inhaler well for 5 seconds before each use. You should use this medication by mouth as directed by your doctor, usually twice daily, in the morning and evening, 12 hours apart. If you are prescribed 2 puffs, wait at least 1 minute between them. To prevent dry mouth, hoarseness, and oral yeast infections, remember to rinse your mouth with water and spit it out after each use. You should also clean the inhaler once a week with a dry cloth, and do not take it apart. Make sure to use this medication regularly in order to get the most benefit from it. It's best to use it at the same times each day. Do not increase your dose, use it more often, or stop using it without consulting your doctor. Additionally, if you are using a different corticosteroid by mouth, do not stop taking it unless directed by your doctor. It may take 1 week or longer before you get the full benefit of this drug, so be sure to tell your doctor if your symptoms do not improve or worsen. Also, consult your doctor for details on what to do if you have new or worsening symptoms. If you experience headache, throat irritation, or stomach upset, make sure to inform your doctor. This medication may raise your blood pressure, so it's important to monitor it regularly. In rare cases, it may cause sudden worsening of breathing problems or asthma, so be sure to have your quick relief inhaler on hand. Let your doctor know immediately if you experience any serious side effects such as white patches in your mouth, signs of infection, or vision problems. If you notice any symptoms of a serious allergic reaction, seek medical help right away. And remember, this is not a complete list of possible side effects, so always consult with your doctor or pharmacist for any concerns. Before taking Breyna 160 Mcg, 4.5 Mcg/Actuation Hfa Aerosol inhaler orally inhaled steroids, make sure to inform your doctor about any allergies you may have to budesonide, formoterol, or formoterol, or if you have any other allergies. Also, let your doctor know about your medical history, especially if you have had infections, high blood pressure, heart disease, overactive thyroid, seizures, bone loss, eye problems, diabetes, liver disease, or other conditions. Formoterol in this medication may affect your heart rhythm, which can cause serious symptoms and may be increased by certain medical conditions or other drugs you are taking. It is important to talk to your doctor before using this medication if you have certain heart problems, a family history of heart problems, or if you have low levels of potassium or magnesium in your blood. Using this medication may increase your risk of getting infections or make current infections worse, so it's important to stay away from people who have easily spread infections and talk to your doctor if you have been exposed to an infection. If you have been using this product in higher than usual doses for a long time, it may be more difficult for your body to respond to physical stress. Make sure to inform your doctor before having surgery or emergency treatment, or if you get a serious illness or injury. This medication may also temporarily slow down a child's growth if used for a long time, so it's important to see the doctor regularly if your child is using this medication. And for older adults, they may be more sensitive to the side effects of this drug, especially the risk of affecting heart rhythm. During pregnancy, this medication should only be used when clearly needed, and if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of any potential interactions with other medications when using Breyna 160 Mcg, 4.5 Mcg/Actuation Hfa Aerosol inhaler. This includes both prescription and over-the-counter drugs, as well as herbal products. It's a good idea to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include aldesleukin and mifepristone. Always consult with your healthcare provider before starting or stopping any medications. If someone has taken too much of Breyna 160 Mcg, 4.5 Mcg/Actuation Hfa Aerosol inhaler orally inhaled steroids and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or contact your local poison control center at 1-800-222-1222. For Canadian residents, reach out to a provincial poison control center. Symptoms of an overdose may include shaking, tremors, chest pain, fast or irregular heartbeat, and seizures. It's important to not share this medication with others. Your doctor may need to conduct tests while you are using this medication, such as lung function, blood pressure, bone density tests, and eye exams. Make sure to keep all medical and lab appointments and consult your doctor for more details. It's important to learn how to use a peak flow meter, use it daily, and promptly report any worsening asthma or other breathing problems. Avoid allergens and irritants such as smoke, pollen, pet dander, dust, and molds that may worsen asthma and other breathing problems. It's also important to ask your doctor or pharmacist if you should have a flu shot every year, as the flu virus can worsen breathing problems. In adults, this medication can increase the risk of bone loss if used for a long time. Talk with your doctor about your risk and available treatments for bone loss. Lifestyle changes that reduce the risk of bone loss include doing weight-bearing exercise, getting enough calcium and vitamin D, stopping smoking, and limiting alcohol. It's also important to encourage children to exercise and eat a healthy diet to help prevent bone loss later in life. If you forget to take a dose, just skip it and take your next dose at the usual time. Do not take a double dose to make up for the missed one. When storing Breyna 160 Mcg, 4.5 Mcg/Actuation Hfa Aerosol inhaler orally inhaled steroids, make sure to keep it at room temperature and away from light, heat, and moisture. It's important not to store it in the bathroom and to keep the inhaler with the mouthpiece down. Also, do not puncture the canister or use it near an open flame. Always keep medications out of reach of children and pets. When you're ready to use the inhaler, only remove it from its original foil package. It's also important to discard the inhaler 3 months after removing it from the original foil package, or after all the doses have been used, whichever comes first. When it comes to properly discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Consult your pharmacist or local waste disposal company for the best way to dispose of it when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.